Chemotherapy has improved in the treatment of our patients, and in particular when we treat our patients with adenocarcinoma, we have identified new treatment lines, and one of these lines is the use of maintenance strategies. And in principle, we have two options. Number one is the continuation of pemetrexed after first-line chemotherapy with pemetrexed-based platinum regimen, and the other one is the use of bevacizumab as a continuation maintenance after first-line combination with a platinum-based chemotherapy plus bevacizumab. I would use a maintenance treatment in patients who had a response or who had at least some benefit from the first-line chemotherapy, and in that group of patients we have seen that we may induce a maintenance of the response by the use of maintenance therapies.
There has been a couple of trials looking at the addition of maintenance therapy after first-line therapy, and I think that at this point in time, pemetrexed appears to be the best treatment to choose for maintenance. Previously also alotinib has been used, but now when most patients are being tested upfront for EGFR mutation status, we'll know which patients have a mutation and which patients don't. And if a patient do not have a EGFR mutation, probably alotinib is not a good choice for maintenance therapy. So the best choice here is pemetrexed.
The use of immunotherapy up front is incredibly promising. We've got very good early signals that this may be appropriate for a small population of patients, and for that population of patients it may be significant indeed. We have evidence from phase 1 studies from cohort expansion, both with compounds such as nivolumab and pembrolizumab, specifically KEYNOTE-001 trial, demonstrating activity of pembrolizumab in patients that are untreated with expression of PD-L1, particularly the high expression of PD-L1 at the 50% threshold or more. At the ESMO 2016 meeting, we'll hear the results of the KEYNOTE-024 study, in which patients with high expressing PD-L1 status over the 50% threshold who are randomized to platinum doublet chemotherapy compared to pembrolizumab will be hearing their outcomes. Those outcomes are currently in the press release, which demonstrate a superiority for pembrolizumab compared to platinum doublet chemotherapy.